Have you heard about white lung syndrome? It's an intriguing and somewhat perplexing health issue that's been making waves recently. This mysterious respiratory illness is caused by an outbreak of a novel bacterial pneumonia strain. Now you might be wondering, what exactly does that mean? Well, let's break it down. At its core, white lung syndrome is believed to be linked to mycoplasma pneumoniae, a type of bacteria that can lead to pneumonia. But it's not just the bacterial connection that's got scientists scratching their heads. They're also considering other potential causes such as viral infections, environmental factors, and even genetic predisposition. So, we're talking about a complex health issue here, one that requires a deeper understanding and a multifaceted approach to tackle. But don't worry, we're here to guide you through it. Now that you know what white lung syndrome is, let's delve into its symptoms. What are the signs that someone might have white lung syndrome? This question is perhaps one of the most critical queries we can ask ourselves in today's health-conscious world. So let's break it down. The symptoms of white lung syndrome can be quite similar to those of common respiratory illnesses, making it a bit tricky to identify, but there are some distinctive signs that we need to be aware of. First and foremost, if you or someone you know is experiencing shortness of breath, it could be a symptom of this condition. Difficulty in breathing, especially after minor physical exertion, is a warning sign that should not be ignored. Next we have coughing. A persistent cough that doesn't seem to be getting better over time, or is accompanied by phlegm or mucus, could be another indicator of white lung syndrome. Chest pain is another symptom to watch out for. This isn't your typical muscle soreness or heartburn. Rather, it's a discomfort or pain in the chest that can intensify while coughing or even just breathing. Fever is another common symptom. It's important to note that the fever associated with white lung syndrome may not be high. However, a low-grade, persistent fever that doesn't seem to be linked to a common cold or flu can be a sign of this condition. It's crucial to emphasize that the severity of these symptoms can vary widely among individuals. Some folks might experience mild discomfort, while others could have more severe or debilitating symptoms. One thing that's clear though, is that if you or someone you know is experiencing a combination of these symptoms, especially if they persist or worsen over time, it's important to seek medical attention right away. Early recognition can lead to prompt treatment, which can significantly improve the outcome. Recognizing these symptoms is the first step. But how do doctors diagnose white lung syndrome? That's a great question, and we'll be diving into that in the next section, so stick around for more. How do healthcare professionals confirm cases of white lung syndrome? That's a question that's on many people's minds, and we're here to unravel it. Diagnosing white lung syndrome involves a series of steps, each crucial in its own right. It begins with a comprehensive physical examination. Doctors are on the lookout for signs of respiratory distress, such as rapid breathing, decreased oxygen levels, and abnormal lung sounds. They also assess general symptoms like fever and fatigue. However, physical examinations alone cannot confirm this condition. That's where chest X-rays step in. These X-rays provide a glimpse into the patient's lungs, revealing any areas of inflammation or infection. In cases of white lung syndrome, these X-rays often show a characteristic white appearance, hence the name. But we don't stop there. Blood tests are another essential diagnostic tool. They can reveal elevated levels of white blood cells, a common indicator of infection. They also help to rule out other potential causes of the patient's symptoms, such as viral infections or other bacterial pneumonias. The next step is sputum cultures. Now this might sound a bit unpleasant, but it's a necessary one. Doctors collect a sample of the patient's sputum, that's the mucus that comes up when you cough, and test it for the presence of the bacteria causing white lung syndrome. Finally, we have the polymerase chain reaction, or PCR test. This is a highly sensitive and specific test that identifies the DNA of the offending bacteria in the patient's sputum or blood. It's the gold standard in diagnosing white lung syndrome, providing a definitive confirmation of the condition. The diagnostic journey for white lung syndrome is a meticulous process combining various medical techniques to ensure accurate results. Each step, from the initial physical examination to the final PCR test, is essential in piecing together the puzzle of this complex respiratory illness. So once diagnosed, what are the treatment options for white lung syndrome? Let's delve into that in our next segment. Stay tuned. What treatments are available for those diagnosed with white lung syndrome? This question is undoubtedly on the minds of many. As we delve into the treatment options for white lung syndrome, it's important to remember that the course of treatment may vary depending on the cause and severity of the illness. First up, antibiotics. These are the first line of defense and are typically prescribed to combat bacterial infections associated with white lung syndrome. They work by killing the bacteria or preventing them from multiplying, thereby helping to control the infection. The exact type of antibiotics prescribed will depend on the type of bacteria causing the illness. Next, we have antiviral medications. If the cause of white lung syndrome is traced back to a viral infection, antiviral medications may be employed to inhibit the growth of the virus. This can help to reduce the severity and duration of the symptoms. Now, let's talk about supportive care. This is a broad term that encompasses various measures aimed at relieving symptoms and improving the overall well-being of the patient. Supportive care can include over-the-counter medications to control fever and pain, hydration to combat dehydration resulting from fever, and rest to allow the body to recover. Lastly, in severe cases, hospitalization may be necessary. Serious symptoms such as difficulty breathing may require more intensive care such as oxygen therapy or even mechanical ventilation. In these instances, the patient will be closely monitored by healthcare professionals to ensure the best possible outcome. It's important to note that the treatment options we've discussed are not mutually exclusive. In many cases, a combination of these treatments may be used to manage white lung syndrome effectively. As always, a healthcare professional should be consulted to determine the most appropriate treatment plan for each individual situation. Understanding the treatment options is vital, but let's also explore the global impact of white lung syndrome. As we continue our journey into the world of white lung syndrome, we'll examine how this respiratory illness is affecting communities worldwide. Stay tuned. How has white lung syndrome affected communities worldwide? The answer, unfortunately, is profoundly. White lung syndrome, a novel strain of bacterial pneumonia, has been reported in numerous countries, leaving a significant imprint on global health. Let's start with China. Known for its densely populated cities, China has seen a surge in white lung syndrome cases. The impact has been felt across age groups, from the young to the elderly, showing us that no one is immune to this health threat. Moving westward to Europe, the Netherlands and Denmark have also reported outbreaks. These countries, known for their high standards of healthcare, have faced challenges in managing the rapid spread of the disease. Hospitals have been stretched to their limits, and healthcare professionals are working around the clock to care for those affected. And then we have the United States, a country that has been hit hard by the syndrome. One instance that stands out is the pediatric pneumonia outbreak in Ohio. Children, typically full of energy and life, have been laid low by this illness, bringing into focus the severity of this respiratory threat. These instances underscore the urgency of addressing white lung syndrome on a broader scale. It's not just about one country or one community, this is a global health issue that demands a unified response. The World Health Organization, along with national health agencies, is continually monitoring the situation, updating guidelines and providing resources to manage this outbreak. The global impact is not just measured in terms of health. Economies are strained as workforces fall ill and schools are disrupted as children and teachers alike succumb to the illness. The ripple effect is wide-reaching, affecting every aspect of society. The global impact is significant, but what can individuals do to prevent the spread of white lung syndrome? The answer lies in awareness, understanding, and proactive measures, but we'll delve deeper into that in our next segment. For now, let's remember that we're all in this together, and together we can mitigate the impact of white lung syndrome. What can you do to protect yourself and your community from white lung syndrome? That's a question many are asking, and the answer lies in taking some basic yet crucial precautionary measures. Firstly, practicing good respiratory hygiene is a must. This includes covering your mouth and nose when coughing or sneezing and disposing of tissues properly. Hand hygiene is equally important, so make sure you're washing your hands frequently and thoroughly. Next, maintaining proper ventilation in your living spaces can also help. Ensure that fresh air is circulating in your home or office by opening windows or using air purifiers. Lastly, promoting general health and well-being is key. A healthy body is often better equipped to fight off infections, so eat well, exercise regularly, and get plenty of sleep. Remember, awareness and proactive measures are crucial in mitigating the impact of white lung syndrome. Stay informed and stay healthy.